I'm Rick McGuire. I'm the executive editor of CardioSource WorldNews, and I am with Miss Suzette Jaskie, president of MedAxiom Consulting. And here at this cardiology summit, I mean, I've got to tell you that it's been exciting sitting and listening to the business talks, but so many physicians are so frustrated with the business end of the business at the moment. What are you talking about in terms of leadership that our membership needs to know about?
Well, I don't think there's ever been a time in the history of cardiology that there's been more of an opportunity for physicians to take leadership and to provide direction and decision-making along those financial parameters instead of being a recipient to the decisions others are making about those.
I mean, physicians at this point have to feel like they're standing in the middle of a busy freeway. How do you provide leadership when all around you seems to be chaos?
At the center of what they do is they make decisions about patients clinically. At the center of a clinical business, at the center of it, clinical should drive all of the business that occurs within a hospital system. If we don't have clinicians at the center of the busy highway making decisions about who's going in what direction on the basis of clinical standards and clinical vision, then what really are we doing?
So what's a good place to start for a cardiologist who's busy and trying to figure out how to work in this new environment that's slowly and maybe not so slowly coming at them? What do you do?
Well, the challenge is that in addition to being physician leaders, they're also seeing patients, running practices, doing procedures, and have a busy clinical day. So the first step is as a group of physicians, for them to decide that it's important that they, as a group, make leadership important and allow somebody the time to put into leadership and create a governance structure with their hospital systems in order that they can do that.
Do you agree that healthcare is going to be more locally driven? There's kind of the concept that it's all going to be put upon you from on high, when in point of fact, from what I'm getting at the Cardiovascular Care Summit here, is that it's going to be locally driven.
Well, healthcare by nature is locally driven and has to be. If we had 100% clinical evidence for everything that we did, if we had double-blinded studies on every procedure and way we see patients and drug, et cetera, then we could be prescriptive. Then we could have a national protocol for the way that we're going to see patients and take care of patients. But we don't have that. We have evidence on maybe 20% of what we do. We interact with other physicians that have nothing to do with our society, but our primary care docs or hospitalists or pulmonologists that don't necessarily ascribe to the same game plan that we do. So therefore, the job of physician leaders is on a local basis to take the evidence and quality they have to establish the clinical standard and make that clinical standard a part of the community they live in. And if they can do that, then they are providing leadership in a local level, and until we have something bigger than that on a prescriptive basis, we don't have the framework to have a national approach.
So where should their attention be at the moment?
On determining what is the best way to treat patients from a value perspective, meaning how do we treat patients to give them the highest quality outcomes for the most reasonable or the least cost that we can. When they determine that on a consensus basis with each other in the context of an integrated delivery system, then that understanding and consensus creates the backbone by which the entire program is built.
So physician leadership is absolutely essential, and this kind of helps explain, this conversation here kind of helps explain what they need to be doing.
Right. I think physicians' primary job in leadership is three things: to establish clinical standards, to create a clinical vision, and to manage physicians. If physicians manage physicians and they adhere to a consensus basis of a clinical standard and a clinical vision, their hospitals will be successful.
And somebody's going to lead. It might as well be cardiologists.
I don't see an argument by which we should delegate that responsibility to somebody else.